Thank you for calling New Directions Benefit and Referral Contact Center. This is Jessica. How may I help you?
I'm trying to find out, do I have coverage for mental health?
We get all sorts of phone calls. Some of them easy, some of them hard.
Okay, let's find out. May I get your name?
The challenges were that they couldn't get an appointment, usually. She would just email a list out, and then the person would just start at the top and work their way down. And they would kind of have to make the phone call themselves out of what we send. And they would say, I called everybody on this list and nobody is accepting new patients. I can't get in to see a psychiatrist till May, June, April, months out. And they can't get to where they need to be. And it's tough. I mean, the past couple of years have been very tough.
I don't want to get out of bed some days. It'd be a struggle, but I do. I get up and keep on pushing. Since I receive insurance, I no longer can go to clinic because they don't accept people with insurance.
You let me worry about that. That's my job.
Knowing that somebody is listening to them, somebody really does care, it puts the person at ease a bit more.
I do have a few other things to go over with you here real quick. These are things that we ask everybody who calls us. Even if it does not apply to you, we still ask everybody. And the more answers I get, the faster it is that I could potentially get you in to see somebody.
When you go through that risk assessment, a lot of times it gets people to thinking and confronting those things that they may be going through. And so I can send them that list, or I can book them that appointment, or I can get them the focus screening to where they can do that too. So if they're looking for a mental health therapist, I can book people within a day or two sometimes, especially if they're willing to go virtual.
So you wanting to go into an office or do virtual visits, or does it matter?
I don't have means of transportation,
So a virtual visit would be okay for you?
yeah, that would be fine.
I got a couple of appointments available on Thursday. Would that work for you?
And then slight pause. Wait, what? Yeah, I can get you in this week. You're met with a little bit of stunned silence. That they want, that they can get that appointment, even with a psychiatrist, within a week.
Thank you. Oh my God. Thank you. I was being a little discouraged.
I love handing out good news like that.
With the Tridiuum aspect, where you can say, this person is going to call you at this date and time, is big for them, because they don't have to really do much except answer the phone call and start talking. And ultimately, if they see that psychiatrist quickly, then they can get that medication. It helps them stay out of inpatient. It helps them stay out of those residential places that they may not want to go to.
Thank you so very much. I'm now feeling so much better.
You are so very welcome. Thank you for calling New Directions. You have a good day.
Connecting with people and getting them to where they need to be. I've done it my entire adult life. And if I live to be 100, I'll probably still do it.